We're Group 7, and the health disparity that we'll be talking about is infant mortality rates among black mothers compared to other races. So to begin with, we'll be discussing about what a health disparity is. Health and healthcare disparities refer to differences in health and healthcare between population groups. So for example, these disparities can happen across many domains such as race, ethnicity, location, so where you're from, gender, or your socioeconomic status. Health disparities take place when someone is predisposed to differences in aspects such as the presence of a disease, health outcomes, or access to healthcare between population groups. The difference between a health disparity and a health inequity is that health inequities refer to aspects of healthcare that can change, such as things like access, conditions of certain facilities, and the number of doctors. However, health disparities refer to aspects of health that you're predisposed to because of certain demographic factors. Health disparities are the same as health inequalities. So as I mentioned, our group is discussing infant mortality rates among black mothers compared to other races. And according to the U.S. Department of Health and Human Services, African Americans have a 2.2 times the infant mortality rate compared to non-Hispanic whites. And in 2014, the mortality rate for white births in Leon County decreased from 5.1 deaths per 1,000 births in 2013 to 3.1 deaths per 1,000 births in 2014. However, the black infant mortality rate in Leon County increased to 11.7 in 2014 from 4.8 in 2013. And the difference between white and black infant mortality rates is still an issue in Leon County and the state of Florida as a whole. This difference in infant mortality rate is due to many African Americans living in unsafe, poor neighborhoods where they are predisposed to negative conditions and poor health outcomes.
Over the past decade, infant mortality rates among the black community, specifically with black mothers, has really skyrocketed. In America, 43.7% of African American women lose their children every year, and that's per 100,000 births, in comparison to 12.7% of Caucasian women and 14% of Hispanic American women. According to the Center for American Progress, most of this is due to black women not having adequate access to healthcare facilities, not having good quality of care, and not having the money to pay for the care that is needed. A lot of times, black women go to get prenatal care and they don't do any tests to find out any underlying conditions that black women have when they're going through these pregnancies. In addition to that, a lot of black women don't have the money to go to the hospitals, and so they don't get any prenatal care at all. So they end up having miscarriages, stillborns, or their babies end up with congenital defects, all because of the healthcare system that we have. In addition to access, cost, and quality being a factor in black women losing their children, racism and discrimination also affects the quality of care that they get. So when some black women go into a hospital to get care, they may neglect any problems that they see, or they may not care to test them, and all while it's causing problems with infant mortality, it's also causing a lot of black mothers to end up dying as well. So maternal deaths are a huge issue as well. And not only is it bad here in America, but it's bad worldwide. But African American women have the highest infant mortality rate in the entire world, and we are considered a first world nation.
Relevancy of access, cost, and quality is no stranger to the world of healthcare, as they significantly impact people's lives directly. Racial disparities in the U.S., such as infant mortality rates, have become a major issue in this country. From the lack of duty because of racial discrimination, to lack of experience of a healthcare provider, to a lack of resources at a facility. These issues all specifically target the inadequacy of quality given within healthcare facilities. Issues like infant mortality rates cause people in minority groups, such as African Americans and Alaskan Native women, to drastically suffer from this issue. Because of this, infant mortality rates are sky high. Many people may argue that the increase in quality results in the increase of cost. However, there are ways around increasing the cost and making adequate healthcare more accessible and better quality. Medicaid expansion, for example, should be more advocated for because there are people that can't even afford medical expenses. According to AmericanProgress.org, doing this should save about 14,000 lives per year and keep money in people's pockets. This is important because most of the minority groups that contribute to high mortality rates come from low economic backgrounds in inner city and rural areas. Doing this should make healthcare more accessible and affordable. Also, in order to balance costs while improving the quality of healthcare, health facilities must also take themselves into accountability by making it more of a duty to hire more experienced healthcare providers, hire people that are cautious and concerned with providing the best quality despite race or ethnic backgrounds, as well as being cautious of representing their workplace, which as a health provider should be very, very important to you. Quality and costs go directly hand in hand. However, access is the most impactful out of the three. It's one thing if you can't afford to be hospitalized at a high quality, but it's another thing if you can't even be seen on time. For instance, here in Tallahassee, hospitals like TMH, Capital Regional Medical Center, they are all in the same areas, but people don't consider that there are disadvantaged people out there that have to drive miles and even hours just to get to their location to get medical attention. Yes, they have access to healthcare at least. However, it's inconsiderate that people have to drive so long just to get seen. People on the South Side have little to no access to healthcare. Increasing access may not guarantee better quality, but it will most certainly open up the opportunity to be seen and to also save a life, which as a healthcare provider should be the most main concern.
Infant mortality rates amongst African American mothers are higher than the rates amongst white mothers. Stress, poverty, economic status, access, and discrimination all play a role within this health disparity. Access can include things such as prenatal care. Many African American mothers do not have the access to prenatal care that they need. This can ultimately affect their infant. In addition, many African American mothers reported experiencing discrimination from medical providers. It was stated that medical providers did not take their pain serious. Issues like these could easily lead to unfortunate circumstances, such as the loss of a child or the loss of their mother. Many of these factors do not affect other races as much as they affect African Americans.
Health disparities have always been, and they will continue to be a growing issue, not only in the U.S., but around the world as well. Health disparities are what causes us to have health issues that we're unable to change, such as the environment we live in, and issues that consistently occur within our race or ethnicity. African American women are put in a tough situation where they're pretty much forced to struggle with their pregnancies due to underlying health issues as well as good quality health insurance. As if their health issues weren't enough, they're faced with discrimination while in the hospital, that is, if they have the access to get there. This causes them to have the highest infant mortality rates among any other race in the U.S. African American women are twice as likely to lose their child than non-Hispanic white mothers, which is said to be due to things such as poverty, air quality, food supply, and poor health care. Y'all have a good one. Thanks for joining us.